A baby elephant stands alone in a village field, bearing wounds that tell a story of unimaginable cruelty and pain. But hope arrives as a rescue team unloads their equipment, preparing for a mission that could mean the difference between life and death. The veterinarian fills syringes with sedation medication, knowing every action from this moment forward must be perfectly executed. The tranquilizer rifle is carefully loaded and checked, the essential first step in reaching an animal too injured to let humans near. The team moves quietly along a narrow path through local farmland, closing the distance to their young patient with careful determination. Through binoculars, they observe the calf's labored movements and spot the facial wound that's preventing it from eating or drinking normally. The veterinarian steadies the rifle, focusing on the elephant's flank where the dart will deliver sedation quickly and safely. The dart strikes true with a soft thud, and the startled calf reacts to the sudden impact before the medication begins its work. Following the elephant's trail through dense brush, they find it collapsed safely near water, the sedation having taken full effect. Reaching the unconscious animal, the team immediately checks vital signs, confirming it's stable enough to begin the critical medical intervention. Gentle hands confirm deep sedation as they begin examining the devastating injuries caused by a Hakka Patas trap and additional leg wounds. The team discusses their approach, agreeing on aggressive wound cleaning followed by powerful antibiotics to combat the rampant infection threatening the calf's life. The close inspection reveals the horrific damage from the Hakka Patas trap, an explosive device that has torn flesh apart with brutal efficiency. Antiseptic solution flows over the raw tissue, cleansing the wound while the unconscious elephant remains mercifully unaware of the painful treatment. The team works with practiced efficiency, racing against their limited sedation window where every passing minute becomes increasingly crucial. Moving to the front foot, they discover additional injuries that weren't visible during their initial observation from a distance. Another veterinarian prepares antibiotic injections, knowing that fighting systemic infection is just as important as treating the visible wounds. Antibiotics and pain medication are administered, bringing relief from the agony that had stopped this young elephant from basic survival activities. The leg wound receives thorough irrigation, ensuring no debris or foreign matter remains that could cause dangerous abscesses in the coming days. An immune-boosting injection strengthens the calf's natural defenses, helping its body mount a stronger response against the overwhelming infection threat. A final application of healing spray seals the leg wound, completing the extensive medical intervention for this critically injured young elephant. With treatment complete, they begin reversing the sedation, carefully monitoring as the medication that kept the elephant unconscious is counteracted. Hakka Patas traps represent a devastating reality. Explosive devices hidden in fields that claim countless innocent elephant lives every single year. Sharing this story worldwide helps spread awareness and prevents future incidents, turning tragedy into a catalyst for meaningful change and protection. As rain begins to fall, it seems to offer gentle comfort to the baby elephant, nature itself providing relief after such trauma. Final footage captures the elephant disappearing into the forest, returning to the wild freedom where it belongs, carrying hope for a better future.